Training Room, presented by Academy Orthopedics, expert care for elite athletes.
All right, joining us for today's Training Room segment to talk a little baseball and some injuries, Dr. Anthony J. Scillia. He's an orthopedic surgeon with Academy Orthopedics. Doc, thanks for being here.
Thanks so much for having me.
You got it. All right, let's talk a little Aaron Judge, the Yankee captain. The Bombers expect him to start hitting off a tee next few days after suffering a flexor strain. The plan is for him to come back as the DH potentially next week. How concerned should Yankee fans be? And do you think next week Judge does return to the lineup?
I think without knowing the specifics of his exact injury, a typical flexor sprain is a common injury. It does usually improve within 2 weeks or so. Timeline seems reasonable. The most important thing, it's a stabilizer, muscle stabilizer for the Tommy John ligament. So it's always a concern to make sure that that ligament's okay, which appears to be the case. And these sort of sprains typically resolve in 2 weeks and then followed by a return to a throwing program.
I just want to ask you a quick follow-up on that. Is there any concern if he comes back too soon that he suffers a UCL tear?
There's always some concern, but with the proper rehab and monitoring and these regimented return to throwing programs, it is significantly less likely.
Does 10 days seem like enough time to figure all that out, or you feel it's going to be a little longer?
That does seem like a typical timeline. There may be some lingering symptoms and require rehab for quite some time subsequent to that, but it is sounds like a reasonable.
Yeah, so we're lucky that Judge avoided Tommy John surgery, of course, which is the initial fear, right? He's going to be out for the rest of the season. Pitcher Clarke Schmidt, however, had to have Tommy John, but it was a different kind of Tommy John, right? He didn't have to have a ligament put in; he just had it reattached. What's the difference?
Yeah, so this is what's called Tommy John light surgery. I was fortunate enough to train with Dr. Andrews, who made the modified Job technique with replacing it with a tendon, and now this his partner Jeff Dugas created this internal brace construct, or Tommy John light procedure, where you can repair the native ligament and use a synthetic strut to support that ligament, allow earlier return to play.
Now, there's a lot of talk about why are the Yankees having so many guys with these ulnar collateral tears, more so than most teams?
I think it's becoming more prevalent, 10% more per year over time. I think these high-level athletes are exposed to a lot even previous to getting to this level. The ligament is not able to remodel and heal all of this micro trauma over time. So if you think about it like a piece of aluminum being bent thousands and thousands and thousands of times supporting high-level athletes, unfortunately, it's a consequence of that they tear.
Doc, let's ask about Garrett Cole. He's 34, right? How about the age factor? How big of a factor is that coming back from Tommy John surgery after a full UCL repair?
The outcomes are typically excellent, and especially in high-level professional athletes, they have the highest rate of return. And as you know, in Tommy John's career specifically, and many others, so it would be very optimistic to have a great career subsequent, even later in one's career.
I want to ask you, because it's not just a Yankee issue. I think I forget who said it the other day, where Major League Baseball is looking at starting pitchers and they're looking at him as Nolan Ryan. Not everyone's going to be Nolan Ryan and be able to throw at that kind of velocity. We've seen the uptick in velocity, right? Mm-hmm. Are baseball arms just not constructed, or are arms not constructed to be able to hold up and stand the test of time and throwing at the kind of velocity that pitchers are throwing at right now?
Yeah, unfortunately, I think that's a big part of the increased rate of injury. The amazing amount of velocity and force that these high-level athletes can generate on a relatively small ligament. If you think about the elbow as a hinge, the inside of the elbow, that rubber band getting stretched repetitively with high-level throwing is unfortunately not invincible, and that's why these injuries are so common.
Yeah, these athletes are bigger, faster, stronger, and you're talking about the weakest link in the chain happens to be the ulnar collateral. That's been as far back as Tommy John when he first hurt his elbow ligament. So that's what I think we're seeing more and more of, is that these athletes are being asked to throw a lot harder and spin the ball a lot harder for a shorter amount of time, and that's why the careers are so short, because of Tommy John's.
Dr. Anthony Scillia, Academy Orthopedics. Doc, we appreciate the time. Thanks for coming in studio tonight.
Thanks so much.
You got it.